DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey there, welcome to the show. I'm Dr. Dan Thomson. Thanks for joining me today on DocTalk. We're going to have a great show. My guest today is Dr. Jim Lillich, and we're going to talk about something that is here and futuristic for medicine. It's regenerative medicine. It's going to be a great show. We're going to learn a lot. Stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed captioning brought to you by VetGun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Dr. Lillich, welcome to the show.
Thank you.
Folks, this is Dr. Jim Lillich. He's an associate professor here in the Department of Anatomy and Physiology at the College of Veterinary Medicine at Kansas State University. He's an incredible equine surgeon, does a lot with equine lameness, world-renowned, and today we're going to talk about something that's really exciting to me, and that's the application of regenerative medicine in horses and
where we take it from there.
Yeah. So kind of give us the rundown. What is regenerative medicine?
Well, it's a broad term, but basically it's trying to use what is within what's within the body in order to accelerate or maximize healing potential. So we know that wound healing is very, very complex and orchestrated by a number of different types of cells in the body. And what we're trying to do is use those cells and what they produce, and we can take them outside the body and grow them in the laboratory and then return them to the body so that the body can accelerate its ability to heal and maximize the healing potential. Rather than use other medications which really aren't necessarily designed for those things, or help in some regards, but let's be honest, Mother Nature's a whole lot smarter than we are. So we're just trying to use what she gives us, know a whole lot more about that process to regenerate tissues. And from the human side of things, the biggest problem is regenerating the spinal cord injury because it's a permanent deficit. From animals, it could be the same things that we deal with, whether it's arthritic change in a joint where you're no longer athletically productive or sound if you're a horse. If you've got an infection somewhere that you need to beat, and that could be within any tissue, and it is not toxic to the body if you use these cells and use these products.
So talk to me a little bit about the arthritis and so give me just kind of like a little description of what I'm going to do, what kind of tissue you're going to take and
Sure. So every tissue in the body, virtually every tissue in the body has got some way to replace itself. So we call those generally stem cells, and there's a lot of different terms, mesenchymal cells or mesenchymal stem cells that are generated from fat. They even can come from muscle, but most of the time we're generating these from fat. All right, so we can take a piece of fat from you, and the cells that can reproduce in the laboratory in underneath conditions that grow them could then expand and help direct or become or help tissue that is back in the body heal itself. All right. So we regenerate that tissue by ramping up those little itty bitty cells that are supposed to do the job. We just give more of them.
Okay,
right?
so you're just taking them from one place and putting them where they're needed.
Exactly. And we know a whole lot more about what they require outside and what they require inside. So that there's other, what they're called cytokines. These are signals within the body and proteins within the body that ramp those things up and get them to do their job.
Well, if you can take some fat off me, which Lord knows I know is regenerative, and put it in my knees, I'd be happy.
Exactly, and that hopefully will reduce the inflammation or cause the body to get better. Help maximize it.
All right, we're going to take a break, folks. When we come back, we're going to talk a little bit more about what we do know about regenerative medicine with Dr. Jim Lillich. Hey folks, thanks for joining me on today's Cattle First Minute as sponsored by Boehringer Ingelheim Vet Medica. When we start to think about breeding season and turning bulls out, the one thing I can't emphasize enough is to get a breeding soundness exam done on your bulls before turnout. And some of the things that can happen during the winter, whether it's frostbite in certain areas of the body or there's things that can happen that will cause a bull to become infertile, are things that you need to make sure. The other thing that's very important on a breeding soundness exam is we have to make sure that we don't have lameness or issues with the feet, because no wheels, no calves. So making sure that we have a sound bull structurally, making sure that we have one that's fertile and one that can produce enough sperm and enough volume with enough motility with no defects in the sperm is vitally important to making sure every year before you turn out to ensure that you get a calf crop, at least from the bull's point of view.
When you're in the cattle business, no matter how much it's a business, it still starts with cattle. It's this basic notion that sits at the core of how we approach things at Boehringer Ingelheim. We understand when you put the cattle first, it just naturally leads to doing the right things. If you want to do well in this business, you start by doing right. Take care of the cattle, and they'll take care of you.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with my friend and colleague, Dr. Jim Lillich, who's an equine surgeon, and he's an associate professor here at the College of Veterinary Medicine in the Department of Anatomy and Physiology, and he is doing some outstanding research and really cutting edge things in taking human application to equine application, and there's much more we can do. But when we're talking about regenerative medicine, taking cells from one spot in the body, putting them where we need help and where we normally don't get good regeneration and healing, Dr. Lillich is working on some things. So what are some things we know?
Well, so regenerative medicine's been with us for a while. There are some well-designed studies out there that document an effect, but we don't know exactly the metabolic or the exact mechanism of how that's going on. So Dr. Weiss, who's in my department as well, worked in the small animal clinic with a couple of the surgeons, and they did some fat cells derived in very damaged or hypnosplastic dogs. And the ones that were most severely affected, they seemed to improve. And it was statistically significant. So in the horse realm, we think that we can actually get potentially better tendon healing, things that are better for the joint, because wear and tear. I mean, athletic endeavors, you pay a penalty for that.
Right.
So if we can keep that system going, functioning at a peak, then we can get the most use out of it, and the quality of life can be better. Clearly that's what we're trying to do for people, is make their quality of life a whole lot better. So what we know is we can take cells, we can put them into certain locations, and we can now ramp them up, and we can improve the clinical conditions of an arthritis. We can improve a range of motion, or we can improve a level of comfort. Do we know exactly what's causing that yet? That's difficult to determine. I mean, we're looking at a molecular type thing. It's down below the cellular level to figure out if that is actually what's causing it.
So the signals from these cells, and I've got to get things down to kind of my level, but the fat cells or the different cells, they actually have the ability to send signals that might trigger the reaction in the cells that are locally.
They're either directing the traffic,
okay,
or becoming part of the tissue, being incorporated.
Okay.
Because we think that since they're pluripotent, that means that they can go from one cell type to another cell type potentially, or fill some of a supportive cellular level role.
So we put these tissues in, and they either have the signals and the tools that the other cells need to do the job,
exactly.
or they're just going to do the job for them and jump right in and become part of that tissue that.
Yeah, certainly, and some of them could be calling in a blood supply. We need more blood here. Some of them can say, hey, we've got a lot of inflammation in the area, and that's actually that's detrimental. Because inflammation is required for healing, but too much of it could destroy normal tissue or potentially slow the process. And we also know that the other side of the regenerative medicine deal is if we can get more comfortable, we can start to use the leg better. And if we use it and load it correctly and walk more correctly, hey, quality of life is improved, and we're probably stimulating healing in that regards.
Awesome.
Rehabilitation.
Awesome. Yeah. Folks, Dr. Jim Lillich here at the College of Veterinary Medicine. When we come back, we're going to talk about some things we don't know about regenerative medicine.
When looking at the number of farm and ranch operations, the USDA Census of Agriculture says cattle and beef production is the largest single segment of American agriculture. The census also says the average age of the American cattle farmer or rancher is in the late 50s. In order to support the continuous supply of U.S. beef, these producers need to do some business planning to successfully transfer their cattle operations to younger, independent producers.
My name is Sam Hands. I'm part of the operation here south of Garden City, Kansas, known as Triangle H. Our operation starts with an irrigated farming operation and also involves cow-calf as well as farm feedlot. So obviously the beef industry is very important to us as a marketing tool of those products grown on our irrigated farm. I feel especially privileged not only to be a part of the beef industry, but to have had the opportunity to be one of the original 6 delegates from the state of Kansas as the beef checkoff system was established back in 1986. And as I reminisce back at that times back there in the early meetings in the mid-'80s and early '90s, to me it was very humbling and gratifying to see all segments of the industry come together with a common goal, and that was to advance the sustainability of the beef industry and by way of a product that was going to bring satisfaction to our consumer.
Hi, I'm Marissa Kleistuper, and ever since I was a little girl, I have always known that I wanted to grow up and work alongside my dad. He has been my hero since I can remember, and got the opportunity to come back home and work alongside my dad on a daily basis and learn from him and watch the family operation continue to grow. And the other best part of my day is my 2 boys get to come alongside and work with us and learn from my dad as well.
But more than anything, as I look at this whole program, is what it's allowed us to do as a sustainable program in the beef industry, and it's allowed us to bring future generations into the operation in order that the beef industry might be sustainable for the future. My pride and my pleasure to have my daughter and her children to be part of our company here as Triangle H. Thank you.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
When it comes to stopping hornflies, cattlemen love their Vet Gun. Today they love it even more because Vet Gun now has a 1-2 punch with 2 VetCap insecticides. New AIM-A abamectin can be used in rotation with AIM-L for effective in-season control. Each delivers a unique mode of action to manage hornfly resistance. So start your in-season rotation program with AIM-L and new AIM-A abamectin vet caps from AgriLabs.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Jim Lillich, who's an associate professor in the Department of Anatomy and Physiology here at Kansas State University's College of Veterinary Medicine. And we're talking about regenerative medicine, where Dr. Lillich is an equine surgeon, understands joints, tendons, ligaments, different things that loading the leg and moving and being athletic. And you know, while we know some things that regenerative medicine can do, what are some questions we still have?
Well, I think these are solid, legitimate questions. How do you know that the cell that you're taking from the fat has now become part of the joint? You know, and that's a difficult question to answer, right? So how do we know we're going to be able to, you know, because some get better and some get a lot better and some just stay the same. Nothing certainly is thought that we've made them worse. So we want to know what the molecule is. We want to know all the way down to what is that cell doing and making, because potentially we can recreate that in the laboratory and put that stuff on the shelf, right? So it doesn't necessarily have to, you know, if it's a generic type protein that's not something the body's going to react to, you know, create an immunologic response to it, because that's how vaccines in part work, right? But if we can put that on the shelf, then we don't have to wait for, you know, gathering or doing a surgical procedure to harvest the cells. We can use some sort of manufactured process to stimulate the healing. So if we know that, then we can get just a little bit better still.
Yeah, so basically, like when we're talking about they're either providing the tools or they're incorporating in the tissue,
right?
We're going to go just get the tools, harvest those from that tissue,
right?
And then you could use it, you know, in any animal or people or
people, right?
Yeah.
And then we wouldn't have to use other medications. We wouldn't have to use a steroid. We wouldn't have to use, because there are toxicities associated with the drugs that make us feel better, right? You know, even from non-steroidal anti-inflammatories to steroids to, let's be honest, opioids. All right. I mean, yes, they're going to improve quality of life. Yes, you're alleviating pain, but there's still a price that you pay for taking those medications. If we can use something natural, then we really don't necessarily pay the price. So we don't know the exact cellular mechanisms. We don't know what a stem cell might need. We're getting much better at it, but outside the body to do and direct it to where it needs to go. Hey, we would like you to go into this bony area. We'd like to go into the joint. We'd like you to help us repair that, you know, and or in the tendon, or in the lung, or in, you know, heck, we could open up the door to the bovine mammary gland, the bovine uterus, you know, things that we can need to beat infections with.
I was thinking of
the bovine lung.
Respiratory
right?
disease would be huge.
And get away from the use of heavy antibiotics or something along that lines. Certainly better for animal safety, for food safety, better quality of life, doing a better job of managing our resources, being stewards of our animals.
Well, the big thing is too is just saving the lives.
Exactly.
You know, having a positive outcome, and when we are struggling with coming up with some of the answers, I think there's some incredible opportunities.
I think that I think we need to begin to ask those questions, right? You know, can this be useful? Can this be something that we use and we take it, for, you know, with cattle, right? You know, can we take it from the cow itself or from the steer itself and ramp it up and give it back? Or can we make the molecule and put it on the shelf, and then they can be dosed or treated in a safe fashion?
Perfect. Folks, stay with us. We'll come back with our last segment on regenerative medicine with Dr. Jim Lillich. Hey folks, thanks for joining me on today's Cattle First Minute as sponsored by Boehringer Ingelheim Vet Medica. Today, we're going to talk about colostrum. Colostrum is the first immunity that a calf receives in its life. Within the first 6 to 12 hours of life, we want that calf to get up and suckle the first milk from the mother. That first milk is what we call colostrum, which is packed with antibodies which then help protect that calf from viruses and bacteria such as E. coli and scours, in which the calf will be exposed to on the farm. The cow is a great source of antibody because she's been living in that environment, been vaccinated for different diseases. She produces those antibodies in the colostrum. We want the calves to be able to get it in the first 6 to 12 hours. So wait to tag that calf until after that calf has had a chance to get colostrum, because it's vitally important for the calf's health, and it's the first step towards raising a healthy calf.
When it comes to stopping hornflies, cattlemen love their vet gun. Today they love it even more because Vet Gun now has a 1-2 punch with 2 VetCap insecticides. New AIM-A abamectin can be used in rotation with AIM-L for effective in-season control. Each delivers a unique mode of action to manage hornfly resistance. So start your in-season rotation program with AIM-L and new AIM-A abamectin VetCaps from AgriLabs.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. We're talking about regenerative medicine. It's something that is cutting edge, that's the future. It's here and it's the future. And this is Dr. Jim Lillich, who knows quite a bit about it. He's an associate professor in anatomy and physiology here at the College of Veterinary Medicine at Kansas State University. He's an equine surgeon, world-renowned equine surgeon. We're lucky to have him on our faculty. We're lucky to have him here on the show, but so what are we going to do?
That's a good question for veterinary medicine. Certainly they've poured a lot of money into regenerative medicine on the human side of things. You know, Harvard's got a $2 billion facility, so that's billion. And where we're headed on the animal side of things, and I think we need to open the door more for the small animal side of things, because we know a whole lot more about what the horses are doing with that and whether that is helpful for the equine athlete. But for the companion animal, you know, the animal that's ridden on the weekends for fun or lives in the house with us, you know, the dog especially, I think we're going to begin to use their conditions and prospectively treat them. Can we harvest certain cells? Can we help those dysplastic dogs? And if we can find a way to make them feel better, they're in turn going to give us the information that's potentially going to help us. Certainly our lifespans are much longer than theirs, but you know, an aged dog at 15 is like the 75-year-old person potentially, or 85, and there's a big need to know that in human medicine, and certainly our pets are actually going to provide that for us, that information for us, those clinical trials that mean something.
Yep, and then there's some things that we can do with comparative medicine in this, so we can learn on animals and apply it to humans.
And hopefully if we can use what we know about the human stuff in the Petri dish, or in the laboratory, or where we grow the cells, then we can use that information back to help our companion animals as well.
Right,
you know?
well
So we have to ask those questions. Hopefully we get the funded research to get the questions in the molecular avenues that we see, that we need to know about, and then take us to the next step, you know, and that is more clinical trials, more directed therapy, refine it to the point where it's a known entity in what we're doing, you know all the mechanisms that are involved.
That's awesome.
Yeah.
Well, folks, regenerative medicine is something that is here. It's something that's going to change the future of both human and animal health. We have researchers like Dr. Jim Lillich here at Kansas State University that's working on it on a day-to-day basis. Him and Mark Weiss, tremendous research potential. We appreciate you watching DocTalk. Remember, always work with your local veterinarian, and if you want to know more about what we do here on the show, you can find us at www.doctalktv.com. Thanks for watching DocTalk today, folks. I'm Dr. Dan Thomson at Kansas State University, and I'll see you down the road.
Closed captioning brought to you by Vet Gun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
For more information about this program or previous programs, go to DocTalkTV.com.
DocTalk was brought to you by Merck Animal Health, the science of healthier animals.
KFRM is one of the largest farm radio stations in the nation, dedicated to informing and entertaining rural listeners from northern Oklahoma to southwestern Nebraska. You can catch KFRM in many ways, of course, 550 on the AM dial, streaming at KFRM.com, or on your smartphone by going to the TuneIn Radio app, or on Ag AM in Kansas on Tuesdays and Facebook every day of the week. KFRM, tune us in. You'll be glad you did.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help? How can we help?
Earlier in my life, I rode bucking horses and rodeos, and my shoulders took such a beating, and that was probably the reason for having several previous surgeries on both shoulders. About a year ago, I decided that I didn't want to have another surgery, and so I contacted Kansas Regenerative Medicine, took their treatment process. It was relatively pain-free. Now, after 8 months, my shoulders have healed to the point where I think I'm probably 90 to 95% of normal. It takes a couple of months to start to see results with stem cell injections, but at about 3 to 3.5 months, I started to feel better. I started to have less pain and feel real progress. That continued to increase gradually until now at approximately 8 months. And I'm extremely pleased. I've got full range of motion. I can lift weights, I can throw, I can do a lot of things that I couldn't do without a lot of pain previously.
When it comes to stopping hornflies, cattlemen love their Vet Gun. Today they love it even more because Vet Gun now has a 1-2 punch with 2 VetCap insecticides. New AIM-A abamectin can be used in rotation with AIM-L for effective in-season control. Each delivers a unique mode of action to manage hornfly resistance. So start your in-season rotation program with AIM-L and new AIM-A abamectin vet caps from AgriLabs.